Hi, I'm John Mascarenhas from the Icahn School of Medicine at Mount Sinai, New York. And I'll be covering where we are and where we're going with anemia and myelofibrosis. So I think where we are has been mostly recombinant erythropoietin, danazol, drugs like momelotinib and pacritinib that we use as JAK inhibitors that can also offset disease-related anemia and have less treatment-related anemia. But where we're going with anemia, which is a major both prognostic factor as well as quality of life issue with myelofibrosis, I think is down a pathway of TGF-β superfamily member inhibition. And the most obvious is luspatercept, which is in phase 3 testing in the independent study. We've only seen top-line data indicating that there was not statistically significant difference in the primary endpoint of transfusion independence with luspatercept, which I must say personally was somewhat surprising as the data to date from phase 2 and our own anecdotal clinical experience is that this is a rather well-tolerated therapy that does have the ability to improve hemoglobins and reduce and eliminate, in some cases, transfusional needs in patients receiving ruxolitinib that continue to need red blood cell transfusion support. So we really are anxious to see the full data set and the granular data likely at ASH 2025 in Orlando from the independent study. And I think that will help us understand how we will further integrate this agent into MF care for anemia, which I will point out is already endorsed by the NCCN guidelines. Now, the drugs in clinical testing, I think there's probably two that are worth mentioning. There's elritercept, which kind of follows along the same lines as sotatercept and luspatercept. These are activin ligand traps that downregulate multiple families of the TGF-β superfamily signaling members that can improve anemia and perhaps even offset thrombocytopenia symptomatology and maybe even splenomegaly. So we've seen early phase data out of Europe with this agent, and this is going to be continued to be developed. And we look forward to seeing mature data and a development pathway likely in combination with ruxolitinib or other JAK inhibitors to address MF-related anemia. The other drug worth noting is DISC-0974, which is an antibody to hemojuvelin, which also is important for the hepcidin pathway and iron availability. We've seen very nice data both in MDS as well as in MF with this agent in addressing anemia. So we're still developing these therapies, and there's probably more to come. But the pathway of interest seems to be TGF-β signaling with SMAD pathway, SMAD activation, hepcidin modulation, and there are multiple angles there that can be exploited. Whether these will be best used as single agents, combination, upfront, or at the time of worst anemia have yet to be determined, so stay tuned.